Hi, I'm Emily Exel. I'm the infant feeding coordinator here at Lincoln County Hospital. Today we're going to talk about breastfeeding and how we know if positioning attachment is effective. I hope you find this informative, and we've got Sam here who's going to help us out. Excellent. Well, what I wanted to do is just go through some information that we like to give every mother before they go home when they're breastfeeding.
Yeah.
And the key things that we're going to talk about really is how we position and attach the baby so we know it's effective.
Yeah.
So how you know it's really effective. So what we like to do is we like to just go through how you hold the baby, because when we hold the baby in a really optimal position, that allows the baby to attach effectively. So how we hold the baby is we hold the baby really nice and close, and we also hold the baby with the head and body and shoulders all in a line, so the baby doesn't have to twist their head to get to the breast. And you'll also notice I don't have anything on the back of the baby's head, so the baby's head's free to throw back. So they tilt their head back just as they go to attach to the breast.
Yeah.
And then we also line the baby up with the nose to nipple. So we want the baby to actually take in their mouth the bit underneath the nipple first, like that. And then the nipple slides in under the roof of the mouth. So if we line them up nose to nipple, they can get a really good mouthful of the breast. What happens sometimes is people try and stick the nipple straight in the mouth, like that. And when we do that, unfortunately what happens is the mouth, the top lip and the bottom lip touch the breast at the same time, and then it squishes the nipple. And that will hurt the nipple, so it's not very nice for mom. But also the baby doesn't get the milk very well because the little tiny ducts are all being collapsed. So it's a bit like sucking on a straw while you're biting through it.
Yeah.
Biting on it. So then you don't get much milk. It's really hard work. So what we do is we've got the baby all lined up, nose to nipple, head free to tilt back, nice and close and in a line. And we also want to make it so it's a comfortable position, so you're all comfortable and you can sustain it and keep it going while the baby feeds. So once you've got the baby lined up, then we have to wait for the gape, and the baby opens his mouth really wide, and you know how it is, the tongue comes down, you've seen that? So the tongue comes down. At that point we lead with the chin, so the chin touches the breast first, and then the baby will be attached. Now, that's quite hard to show with my doll and my knitted breast. So what I usually do is just get out a little magazine and show you that picture. So I've got a really nice picture here in the magazine, and it shows a baby. This little baby here is nose to nipple, and then you can see that the chin is touching the breast, and the nipple just slides in under the roof of the mouth, and now the baby's perfectly attached. And there's 7 signs of knowing that the baby's perfectly attached. And a lot of them you can just check by looking at your baby. So to check and see if the baby's got it right, if you just check and look and see if the chin is touching the breast, it should be tucked in nicely. And then if you can see the lower lip, that should be flipped down.
Yeah.
Then you get to the mouth, and that should be a really wide angle. Can you see there? That means the baby's kept their mouth open really wide as they came on. And then you should see rhythmic sucks and swallows with pauses. So you see that mouth action. And then you can see the cheeks being nice and round. If the cheeks are sucking in, it just means the nipple's at the front of the mouth, like that. So you want them really round, and that means there's lots of breast tissue in the mouth. And then we get to, at the top of the lip, the baby's top lip, if you can see any of the brown bit, that's the areola, more is visible above the top lip than the bottom lip. And that means the baby's just slightly off center, which is really good because it allows the baby to get more in their mouth.
Yeah.
And then the last thing is we ask you if it hurts. Which I always think should be the first thing, really. Because you don't really have to check the rest. So you just check and see if it's hurting. Now, when the baby first latches on, it often does really, it's very uncomfortable, and most mothers go like that, and that's because the nipple's being stretched out.
Yeah.
You had that feeling, haven't you?
Yeah.
But then it should get better.
Yeah.
When,
You're like a pair of pliers, aren't you, when you first attach? But then it's fine once it's...
They've got a really strong suck, haven't they?
Yeah.
And then once the nipple's drawn out, it gets drawn out, sucked to the back of the mouth, then actually it should be comfortable. But if you expect your baby to feed 8 to 12 times in 24 hours. So it is quite a lot of feeding.
Yeah.
Yeah. So if they feed less than 8 times in 24 hours, it's worth just, encouraging them to have more.